Good morning, ladies and gentlemen. When my daughter was undergoing treatment for cancer, she and we asked doctors many times, apart from medicines, why there wasn't consultation with dietitians, nutritionists, and why didn't food and other supplements were prescribed to improve the immunity of the patients, but nothing came forth in the 5 years of her treatment except administering medicines as per the standard protocols. This issue was raised and highlighted by me in the short film Empathy made by me. Recently I came to know about Dr. Sampath, who claims to have done extensive research in partnership with oncologists across the globe and came out with some tailor-made food supplements for the cancer patients undergoing chemo and other treatments. Patients can take benefit of a free consultation and 14 days free trials from Dr. Sampath. I am presenting this conversation with Dr. Sampath for dissemination of useful information for the benefit of cancer patients. This presentation in no manner be treated as a marketing of their product or services, and I or my channel in no way vouch for the efficacy of their products and services. Viewers are requested to consult their oncologist and try and use these products strictly under their guidance and supervision. Good morning, ladies and gentlemen. I am Prabhakar. In today's conversation with Achievers, I have Dr. Sampath, who has completed his bachelor's degree in medicine and master's degree specialization in oncology from China. He also pursued his naturopathy of medicines at College of Naturopathy Medicine, China. He has several papers published in international science journals. Dr. Sampath is a renowned oncologist, nutritionist, and clinical research specialist. With over 10 years of experience in drug research and nutraceutical sciences, Dr. Sampath has several products patented to his credit. Key nutraceutical products developed by him include micronutrient powder for cancer, diet for diabetes, and patients suffering from obesity. Dr. Sampath has a proven track record of manufacturing and processing over 100 herbal tea varieties of Ayurveda nutraceutical products to fix cancer, cardiac, respiratory, asthma, gastrointestinal, and other non-communicable diseases, and administered them with wonderful solutions. Welcome, Dr. Sampath. How are you doing?
Yeah, I'm doing good, sir.
Now coming to your medical days, is there reason for you to do medicine in naturopathy and not doing in allopathy?
Well, actually, I'm not a naturopathy kind of background. I'm background from the MBBS,
Okay.
Bachelor of Medicine and Bachelor of Surgery. And but practicing the thing in nutrition and naturopathy way, because I adapted it. And after I understand a lot of things from where the cancer, because my other subject is the cancer. Now I'm practicing that how to help the cancer patients.
Okay.
In that way, I adapted nutrition and naturopathy way.
Okay. Is there any specific reason for doing it from China? Is it not available in India?
No, actually, I did my MBBS from China, MD in clinical oncology from China itself.
Okay.
And my basic thing is that my university is affiliated with many other universities, where we are practicing a lot of like clinical research in different kind of drugs and all. In the way I was in the oncology department, where I was a clinical oncologist, in the research oncologist. I've been understanding the wavelength, how we are going to treat the patients in a cancer patients. Is it really help allopathy or not? But the time being, we understand many situations that allopathy can help for the certain periods where it can help like 50 to 60%. To adapt that, some kind of requirements are there. I'm fulfilling the requirements in the where it is needed.
Okay.
Actually.
Now coming to cancer specific, the most dreaded disease, can you briefly tell us why any person gets cancer and in most cases without any visible symptoms?
Cancer is actually cancer. Cancer is not a perfect disease, I can tell today. But I can tell that what is cancer? Cancer is nothing but one cell which it can have a capacity of replicate without knowing gene mutation or without DNA mutation. It can be telling a story like a different, but according to me, what is a cell? Because the cell gets the energy and it without any mutations or gene modifications, the cell will give birth to another cell. But here, without cell dies and give birth to another cell. Here, the cell will not die, but the cell is giving a produce and replication by and many cellular division. It giving in many different abnormal growths of cells. That abnormal growths of cells because lack of many things like many deficiencies we couldn't tell that because of only this the cancer has come. But in the particular time being we can tell that cancer is not a thing that we can decide only through this we can get it. Because in the scientific, I'm challenging anyone, cancer is coming only due to this, no one can tell. Yeah.
Then second thing which always comes to anybody's mind is that in most of the cases, doctors, even oncologists fail to detect cancer at an early stage. And not only in case of poor or the people who don't go for regular tests. If you see cricketer Yuvraj Singh or a lot of top film stars, who are very health conscious because of their profession itself demands they're going for regular checkups. Even in those cases, the cancer could not be detected, and in I think Yuvraj's case, it was detected in 3rd stage. In some of the film stars' case, it is at the 4th stage. So, is there any specific reason that certain cancers all cancers are not able to be detected early by the doctors and the oncologists?
Yeah, well, question. This is a question. Can address the answer is a little bit impossible, but I can tell that why it is not detected in the early stages. Cancer can enter 3 different ways. Cancer itself can have the cellular division in the particular situation area, it can have a spread. And the cancer can easily adapt by the lymphatic drainage system where we have the things like the plasma where we enter the serum particles enters into the plasma there from the lymphatic drainage system. It can supply total towards the body. There's the one system the cancer can enter. Another way is the blood. Blood is the biggest transport organ in our body. It can have a high chance to enter from through that as well. But most of the cases, the doctors, researchers and the scholars will demand in the patient to understand the diagnosis progression where if it is a small level example, some MBBS doctor, some reason might be answered. Some other extension level of the general medicine or some senior like a faculty where you go with senior consultants, if you go with the disease with example somewhere, and cancer is not a particular way whether we can tell that today it is entered or tomorrow it is no more. How can I answer this How can I answer this? Simple, sir. Virat Kohli or some Yuvraj Singh, whatever you say, he addressed the cancer in the 3rd stage. The person who already diagnosed in the earliest as possible, he did, but there is no detected, correct? So there is no detected. Clearly, the professional way of to understand the cancer levels is not a doctor can prescribe very easily. It's like a method where we need to follow, because the affected of the disease and the progression of the disease and the symptoms and the things what earlier could be happened That all the things depends upon the maturity level of the patient, how he addressing the doctor. And meanwhile, I can say for the people are going for the doctor for the not in the early stage, it is not detected. Because there is no of such awareness things where patient to understand what are the symptoms of the cancer, how the cancers are affected, and the cancer is very how the easy way to get the cancer. So we need to give in the schools, in the colleges, in the public places, in some kind of motivated speakers, awareness programs to be conducted. So by the late the patient can do, at the late the doctor can detect. There is no specificity we can answer this, because I can truly tell that of humble cancer can be detected in the early stages or not in the late detection, because only from my suggestion is as soon as the symptoms whatever it is there, CBP is the main gold standard of check. You need to check with the lymphocytes.
Okay. What's CBP? What's the full form of CBP?
CBP, complete blood picture.
Okay.
So you need to check like how glucose percentage, how your hemoglobin percentage is there, RDW is there, and you need to check with your lymphocyte, neutrophils. You need to check thoroughly like 3 to 4 months in this biological age of period, that I can explain you what is biological period in the other way. Today I'm going to talk is we need to understand the patients these kind of where the criteria where we are in the life right now is not a small one. So the checkups should be like with the blood test, simple blood test, CBP, CRP, high rates of CRP you need to test, and according to the symptom you need to coordinate and you need to explain to the doctor. Then we can address early as possible. But one more thing is there, in the stage 1 also, stage 2 also, if you detect the cancer, the stages we cannot know. But after confirming the diagnosis, it is a cancer. There is other specific tests. We need to go with HPE correlation, biopsy. That is the second, third levels, That is not a simple background we can understand. So there is a late phenomena where they can detect the cancer data stages. So the basic level, it is not easy, because the basic level you go with the basic doctors, not directly cancer. You're not suspecting.
Yeah, directly you don't go to.
Yes, that's the main reason. But everyone should have an awareness program where we are doing for the HIV, AIDS, that kind of things. We need to give some kind of awareness programs
To cancer patients.
to the cancers, mainly for the ladies, for the women's. Like what I can say for the women, like a 25 age to 30 age group, they are very easy to adapt the cancers like a breast cancer, ovarian cancers, fibroids, that kind of things are there. So for that the solution is that they can meet the gynecologist in the age like a 15 to 25 age. They need to understand their levels of the hormones, and simply every woman they will not get anything. This is very fast as a man. But these days the women are getting the highest point of diseases where it is related with the cancers. The first thing is that my suggestions, they need to keep in touch with the perfect gynecologist. And because obstetrics and gyne is a very important subject here, they need to get in touch with their gynecologist. Even they are like a period means, or if they have the problem with the general health checkup, or they have a problem with really gynecological related like a pregnancy case. Gynecologist to meet is like how they healthy, they can check it. It's not a simple thing that they can only think that I am not pregnant, why I should go with the gynecologist. There is no such a rule that you need to check that how healthy you are, how you are balancing your hormones and everything. Just keep in touch with the gynecologist. Very good advice from my side, where you can have early symptoms to understand what kind of things is in your body is going to take place. My suggestions for the women like this. And we need to give the vaccines also. The best vaccines has come. The HPV vaccines, human papillomavirus vaccines. There can lot of awareness if we give and detect that in the early stage. Before that, like 25 to 26 age, that's a good time to get the vaccine. They will get the immunity levels in the certainly, and they can postpone their breast cancers, ovarian and fibroids. These situations now we are in the place where we are like in the complete technology side. in this situation, they have to get suggestions with the gynecologist as well as for the women.
That's a very good advice for the females. But
Yeah.
what about males? In the same way as you were saying that 15 to 25 or 15 to 30.
Yeah.
Does a male also have some checks to be done?
Simple for everyone is CBP, CRP every 3 months to 6 months they have to do.
Okay, for male also.
Everyone. For the male, certain hormones only will not work when they are in the stress.
Okay.
Other than that, they are good enough. They need to do only few things. They need to follow the routine ways. That's all. Yeah.
Is there any real treatment in cancer cases, especially when a patient is in the third stage or fourth stage, or is it just managing it for whatever period they can?
Truly, I can tell all the viewers who are seeing the program, there is no treatment for the cancer, but only medical management through allopathy and extension of life through nutrition. Why I am telling this word nutrition is very important for the cancer patient. There is no cure for the cancer. Only prevention we can do, the expansion of spreading of the disease we can stop through making the healthier cells to opponent the cancer cells to be attracted them.
Okay.
What is the basic treatment for that? The treatment is only the nutrition, only the way which can help allopathy and the cancer patients for the survival rate to be increased. So I totally can address this answer only through the nutrition is the only the way to the cancer patient can stop the cancer deaths. Other than that, I cannot say that today you take the medicine, tomorrow the cancer will go away like a headache or fever. There is no such a thing for the cancer.
Okay. So this I can watch for it because as you know that my daughter has gone through this fourth stage cancer.
Yeah.
And my experience and my daughter's experience especially has been that all the time she was administered chemotherapy and guided medicines, and repeatedly we used to ask the doctor, is there any special diet to be taken, or is there any nutrients? We used to ask, where is the nutritionist in your hospital? We want to meet, want to know what special diets we have to take or what special precautions we have to take. They simply used to say, don't worry, everything is taken care of by the medicines. Apart from the chemotherapy, we are giving medicines, nothing else need to be done. And for 5 long years, I don't think they have ever prescribed anything to be taken. So why it is so the scenario as far as the treatment in allopathic by oncologists?
Next question. For this, I cannot blame the doctors and I cannot blame the patients as well. But we need to talk through the distance and relation between the patient and the doctor here. Many of the doctors will tell that meet the dietitian or something else they can tell. But truly, our mentality of Indians or something, dietitians is not that important in the form of treatment. There is no such a way of awareness on nutrition, how it impacts the cancer patient, how it impacts the treatment of chemo and radio or what is immuno, because the tolerance of the patients is very, very, very big criteria, and very important thing is that we need to understand the tolerance of patients is nothing but the resiliency of immune system, how it works in his body is very important. If example, if you take your doctor, the doctor prescribes the chemo, he'll send some cycles. For that first he'll ask you how you are eating. The doctors will see the patients and ask that you are not, you're so weak, I guess you're not suitable for the chemo for some while days. Improve yourself and raise your energy levels, then we can go ahead. Lot of doctors will tell this. But apart from this, but the drawback of in Indian system of medicine, what is the drawback is the complete awareness of nutrition or guided nutritionists or dietitians will come into the form as the doctors. They sit in the cabin and they explain briefly and explain thoroughly what is the importance of nutrition, where they recommended of the treatment, how it helps. There is a lack of awareness is behind that. For that fulfill of awareness and lack of lack of subject, lack of knowledge on how the chemo are giving the weakness, and the weakness parts how we are going to cover, and where we can cover, and what subjects and what methods can help that cover this chemo or something, whatever the doctors has given from prescribed from this side. And we need to educated system of medicine is not there in India, I guess. And right now, this is the solution where we are adapting as a clinical oncologist, where I'm an MBBS background person and clinical oncologist. We understand strictly that the cancer patients can be died with the appetites. Cancer patients are not dying with the cancer. This is the thing I am going to explain every cancer patient. Why? Because today many cancer patients are dying with the cancer. Until you know you are coming to the hospital, you are well. After you are addressing the hospital, you started taking the treatment, you started making your cells to be, immunized cells will be completely weakness. I'm not going to blame any other allopathy doctors or my doctors or anyone. I'm here to help only the cancer patient to understand where is the chemo or radio, whatever the treatment you are getting, like a chemical compounds in your body, automatically every cell will have their own deficiencies and side effects. To overcome that, to resistance to get from that, we need to understand how the cells will get weakened. Example, I will tell you, when you're going with the fever, when you're taking a Dolo 650 or running with your tablet or whatever is there for the 4 to 5 days, you're certainly not going to feed yourself by how you're feeling by day, or how you were before. No. Here the cancer patient the same, I think, yes. You know, some people are with the nasogastral tubes, some people are with oral tubes, or some use the NG pipes or whatever it is, tubes. Some patients can eat, but they are not going to eat well, and they are under the chemo. It doesn't know why there is a weakness. They think that some anorexia, orexia, cachexia, because of the treatment is going and the chemo is making like this. No, the chemo is doing somewhat because that it can weaken the cell. Chemo is only the certain place you are attracting it, you are going to kill one place. But chemo is total over the body. It can have a high chance of weaken your cell. So our doctors also prescribing to meet the dietitians, but we are neglecting every dietitian or nutritionist in India for the cancer patients. Especially I'm telling all the cancer patients, please visit all clinical nutritionists nearby you or onco nutritionists be nearby you. They can give a complete clear picture where it can support the chemo, radio, immuno, whatever the treatment you are getting from the in the hospital side. And the method of the treatment of the doctors, they are not failing, they are failing only to the awareness and lack of the cell to be how the cell get energized. Here the point of treatment is only to the doctors and the nutrition I'm talking about, how well we are giving a cell good energy levels to fight against the cancer cells. Let us not make the cancer cell to attract it. We will give the good guidance for the cancer nutrition and help every patient what to eat, what not to eat, how to eat, in how the calorie deficiencies will be there, where we need to fill every area, every place we need to work out and help the cancer patient. Then we can, a chemo or radio, whatever it is there, it will help the treatment ongoing. Cancer nutrition is very important. And we are here to address all the people. We have the best team to work out on every cancer patient. It can be any kind of cancer. We are ready to treat them with our nutrition way of workshop. And there's many cases of doctors are sending the patients to our nutrition center, cancer nutrition center, only for giving the suggestions on the complete nutrition, what they need to take or eat. For that, we have good kind of nutrition products, nutrition such kind of suggestions and diet plans according to the feasibility of the patient as well. So that's the thing we are going to give. But I'm talking about the clinical onco-nutritionists, all clinical nutritionists are ready to help all the doctors ongoing their treatment. During the treatment, this subject of nutrition is very important during the allopathic treatment. That's what I can guess. It works well to extend of their lives.
So So that's very nice, doctor. What I get from you is that apart from administering medicines, improving immunity should be given equal importance so that good cells do not get killed in chemo treatment. Of course, certain cells definitely get killed, but they are either replaced or equal number or large number of good cells also are there in the patient's body, so that the patient doesn't get weakened and not able being ready to undergo treatments, and the life gets shortened.
Thank you so much for giving an opportunity to talk about this question. I can tell the few tips regarding this kind of program. Many people will say that chemo is good or bad. Many questions are there. I cannot say right now chemo is good for whom, chemo is bad for whom, because it depends upon the organ damage due to the cancer, or the thing is affected seriously. We can go through the PET scans and all. That is totally depends on your doctor, how he is going to plan your cancer proper plan. But whatever the plans they are giving, they have to give 100% importance to the nutrition side. That can help any other targeted side effects to be overcome, because to overcome the things are only if we can fulfill the energy of a cell. Everyone is working for the energy of a cell here. We are not at all anything like, we are not talking about anything that cancer can be gone from the patient. How the affected cells are attracting the good cells, number of healthy cells, where we are making that the healthy cells should not have a weakness of its own and get attracted with the affected cells like a cancer cells. To overcome that, we are only to fight and how to adapt and how to help the patient, what kind of organ is affected, what kind of treatment is going on that, and how doctors are giving what kind of targeted drug for that targeted, how much side effects are there. To overcome the side effects, what kind of help we are going to give from our cancer nutrition center. Everything will be like a professional way we are doing, because we are doing the background from the London. Already we trained well in the onco nutrition way in the overseas, from the overseas, and we learned a lot of things to how the cancer nutrition can help the patients in a different targeted therapies, targeted drugs are introduced to the patient, and different organs are affected.
Okay, that's good. Now, can you please briefly explain? Actually, you have a lot of products which I told in the introduction.
See, the products is depends. No. We are not here to talk about the products today. The products is not a products. It's supplements.
Okay.
We are giving. It depends on the product, the problem, how they are addressing, and which supplement is good. The source of nutrition we get. Then only I can tell that answer.
Now, this is a very important question. Most of the patients who have started the allopathic treatment, and allopathic doctors always advise not to mix any other form of treatment as far as allopathic treatment is going on. How do you address such situations that, when people say don't try anything else? So how a patient can take a chance of using your products or any other products for that matter?
That's good. First thing is that I want to give an awareness thing on this question. We are background of allopathy. We are not from some other kind of alternative treatments here. There is no alternative medicine here. The way I am treating the patient is completely nutritional science way. Nutrition way. So the nutrition is come from the science. The science we study and we adapted the different kinds of things. How, example, if I take some kind of drug we produced like a chemical compound, the same thing the drug induced we produced from the plant based. There is no such a side effects. Which is in the supplement way. We are talking about the supplement way. So there is no such argument I am talking about. We are like an alternative treatments guided person. We are completely for the nutritional way. We are giving 100% health procedures to the allopathy treatment. We are not out of the allopathy. Okay. We can understand the situation of the whatever the chemo he is getting. We have the background from the oncology backgrounds, so we can understand the patient, how they are in the stage and what kind of treatment he is getting and what kind of targeted drug is being given and how he diagnosed and which time he is get the diagnosis, and how often can patients you have the survival rate, and everything we have the analysis of picture is very in the criteria. So we are not like some kind of Ayurveda or some kind of Unani, some other things. No. And they are doing the best, but I am talking about, I am not going to tell. Okay. See, today we are only addressing the nutrition to support the allopathy. Okay. We are not going to give some the other kind of heavy metals or something else to mix with the chemical compounds. Yeah. So we are purely in the side of allopathic way, where we are giving and support to the as a nutrition part to the allopathy doctors. Okay. Not only allopathy doctors, we can give support to the Ayurveda, Unani, whatever the people will ask from us. We are ready to give the nutrition subject. Okay.
Yeah. It's good, doctor, that you have developed something which is supplementing to the treatment which is going on. Yeah. But the issue is that the patient and the patient family members, especially the parents are the children who are taking them to the hospital, completely rely on the advice of the oncologist. And are they, that means the allopathic oncologists, prescribing your products or supporting your products, or is there any collaborations between you and the oncologists where if not prescribed, at least they don't use it?
No. See, allopathy, we are not opposing the allopathy, they are not opposing us because the background is same. Okay. The science background, we're talking about the science background. Yeah. So allopathy and nutrition, if you go to any hospital, they have their own dietitian, they have their own nutritionist. How can they delay our treatment? Mm-hmm. And by the way, we are not going to give any other kind of herbal or something else what we treat. Mm-hmm. And we are treating completely on the nutrition way, the diet chart, supplements, what to eat, what not to eat, and how the patient will get well soon within 5 to 10 days. Mm-hmm. If he's a bedridden person, can he walk? No. So with our nutrition supplements or nutrition subject, whatever the diet charts, whatever the plan of program we give, some extent of he can sit on the bed and he can stand, he can walk a little bit. Slowly we can give an improved energy levels to get over system. So for that there is no other background to oppose the allopathy people to us. So we are supporting, we are the nutrition background, we are the clinical research background. We are completely like a supporting factor to the allopathy doctors. There is no deny or something subject for the nutrition with the allopathy. Yeah.
Now coming to every medicine or every health supplementary products, in such cases the certifications are very very important. Is there any certifications in your case, or all the drugs and all the things have to go?
First thing that we are talking about, there is no drug involved here. There is such a treatment which only support the diets and plan of action for the nutrition way, how to help him to eat the food, how to help him to feed himself very well, how to help him come from the nausea or akachasia outside, and how to help him do his work himself. That kind of plan of food, nutrition, only workshops are going to here. And the things, the supplements, we have enough the license to get from the PhySci license, and some supplements where we need to get, we are born with some kind of Ayush licenses. Where we need some kind of food supplements in it, that we got a PhySci license as well. And because they're manufacturing everything, and many things, yes, these are very things we imported from the R&D technology. We imported a lot of supplements from Germany, China and America, as well as some where we need a top-notch global to import our raw material as well. But I'm not talking about today about the subject, because only I am addressing that the awareness of nutrition is very important for the cancer patient, where they are not at all addressing the nutritionist. They are going to, I am telling you today, cancer patient will not die with the cancer. Cancer patient will die with the diets.
That's good. That's a good statement. Now coming to the, as you know that cancer itself means apart from the patient drains out because of the treatment which goes on onto his body.
Correct.
But if the family drains out financially, so the food supplements, how costly or how reasonable they
First thing that we are not talking about the cost today. We have a helping centers in Hyderabad. We started a new group called for the feed poor kind of things, feed the cancer patients, like kind of things.
Okay.
We are addressing that. Many people go with alternative therapies and many people will go and address them. This is not an alternative. This is a right way. You come here for the cancer nutrition awareness workshops will be there, and we will be addressing whatever the disease you have been finding with your allopathy doctor treatment is going well. We are not going to oppose or deny any other things. We are going to cooperate the treatment the way what he is doing, and we adopt some kind of nutrition workshop to him, and will guide a proper nutrition diet plans to him. And in such a way, our center phenomena in our center, such a things we are going to do in a different way. So what with the cancer, what kind of cancer, the free consultations are there.
Okay.
And the 11 days we are giving a free supplements what suits with the diet plan.
Okay.
And we are going to give them cancer patient with the appointment is there. Only for the cancer patient we are giving some kind of food for him to when he comes to our center.
Okay.
And these three things are very complimentary to come to our center and take the things. There is no such charge for that actually.
Okay.
And if they are doing progress, if they are doing well with our company, our whatever the suggestions from our nutrition side and the cancer nutrition center, after 11 days, if he's doing well and well, then the supplements whatever that we written in the we given the freely, then after 11 days he can continue buying himself, because we cannot give every patient freely for the naturally. Yeah. So whatever things, our free consultation always remains for the ever. We want to help the cancer patient. There is no such a difference in that. But after 11 days, how the costs will be there. Many people of the cancer, they can spend much whatever they spend. But here we have ethics. We are following some rules. Very important rule is for every supplements we are not going to charge more than 5,000 to 6,000 rupees, because it's a nominal thing. We are not charging. First we will tell them, let them prepare themselves, we will give the chart. If they are not going to prepare by themselves supplements, they can go for the alternative way. If they prepare, it will be like a 4,000 to 5,000 they can complete per month. But if they are not able to do that, it will cost more, goes for the preparation way, the whatever it is. But the nutrition workshop will decide. And the person who is going to prepare and give, we will have the vendors, we will give the to the vendors. So what the service we are doing for the cancer is free consultation, free 11 days program of the free supplements from ready-made, and we are giving food who comes to the cancer, who the cancer patient comes to our center is completely free, because we got a group of people who are helping us to take in the cancer feeding and all. And we are doing the best. And I'm suggestion is that please come to center, visit and take one kind of appointment. If you go think that it's good working it for you, then continue with us. Otherwise, you can deny by yourself.
Okay. Now coming to the marketing part of it, that when you said that people can visit your centers, what are the cities in India where you have your
Right
centers?
now we started in Hyderabad, because I cannot address any other place, because I am already training a couple of doctors.
Okay.
Who are interested in working in the oncology nutritionists, so oncology nutrition. So we are guiding them as well to work in the workshops. Right now we are doing for the functional medicine kind of functional medicines, functional kind of medical care team. We are working out in the nutrition. So we'll guide soon we'll open all over the India as well. Now we are addressing only in Hyderabad.
Okay. So apart from whatever products you have right now, are you doing further research on cancer?
Yes, the R&D will not stop, sir. It will be continue.
Okay.
Because our team is a very good team. We are a lot of team from the outside, like different countries as well.
Okay.
We are from few people who are working together from the other countries.
Okay.
And certainly I am the one of the clinical research over there, research person involved. So that the best of our cancer nutrition center will do the best for the cancer people.
Okay. See, normally we follow, we have tendency to follow something going abroad, especially US and other places. So, what is the scene as far as this thing which you are propagating here in America or China or other places?
Good, sir. Actually, we train from different countries, so we adapt the motto and sportiness, the kind of treatments. If you go to the Cleveland for the nutritional cancer nutritional things, the way how they treat, the way how they give proper prevention and life extension things, and how can help the cancer patients in a passionate way, the same way we are going to adopt in India, in Hyderabad. It completely, you can try the best, and we are doing for the best for the cancer patient to overcome out it and make themselves, they are free from the cancer. We are not going to address only the cancer patient with the nutritional way. We are going to adapt them with the stress levels, management psychologically, and depression side. And everyone thinks that I'm going to die. Cancer means I'm going to die. There is no such a thing that it can be. It can post your deaths. It can postpone your deaths. That's also very important things. And how we are psychologically impacting the patients is also there. This center is not for only for the nutrition guidelines. It's also psychologically we can help them.
Yeah, that is also equally important. In fact, that is my next question.
Yeah.
That is one thing which I always used to tell the doctors and healthcare people who used to attend my daughter, that just when people come and mechanically you do chemotherapy and all those things. Apart from that, psychological sessions and motivating people, as you say that nothing is lost and you can still battle. Like
yes,
that's very.
That's the thing. Actually, here I have seen the 50,000 more than cases in my 10 years of program. What I'm going to do this. Well, we from the College of Naturopathy of Medicine says one word: you don't do harms to the patients. At least you know something, you help them. Otherwise, don't harm them. The policy we adopt. But here, what strictly we are telling that how much percentage we can help them is the 100% we can extend their life.
Yeah.
That is my guarantee. But I cannot say that 100% the cancer will go away. If I say I'm wrong. I can tell that by the way the cell is strengthening and weakness, and after you're losing weight, 5 phenomena is very important for the cancer patient to check with themselves. The growth is there or not. Example, the full weight loss will be there. Hair fall, nails, the structure will be changed, become short, and looks you are having some disease, and skin changes. And the way of smell from the mouth will changes, and very important is that all the blood parameters will show abnormality. So, and electrolytes imbalances will be there. They're all corrections we give in profile line. Every week or every 10 days we are going to check your parameters by the way how you are before and after. That shows the result of the cancer patient, how they are improving. That's only the workshop we do in our company. Okay. Other than this, we are telling that cancer will go away its own. We are doing miracles. This medicine gone. There's no kind of things. We can only for the target the patient to live more than 15 to 20 years. How we adopt the things and help them. That is only the motto we are going to help them.
That's great.
This is sincerely advised. Many patients will tell that I went to something, it has gone. There is nothing will go anywhere. Cancer remains. All people are having the cancer, but the aggressiveness, the cell replicates, it will not tolerate, and mutation, DNA changes, cell division happens, then cancer cell will be found in your body.
Okay.
So my suggestion, cancer patients will not die with the cancer, they die with only appetite. Here we are, the cancer nutritionists are present in our cancer nutrition center at Hyderabad. Please consult us with no charges, nothing. And you no need to think that we are going to charge in a different way, nothing. We have enough things there. Our charity persons are there to take care of that. And here I'm serving the people, every cancer patient. I want cancer patient survivability rate should be very high. And we hope that first you try with our cancer nutrition center. First you take an appointment, and meet us completely free for the 11 days program. If you really satisfied with your things, that you can travel with us and you can understand how the weight treatment. If really it not works, no need to come to our center for after 7 days. For the consultation free, and we will give the food for the cancer patient, and the 11 days medicine or whatever the supplements from our side. You think in the medicine, but I give the supplements is completely free from our side. Visit our center, Cancer Nutrition Center at Hyderabad, Nizampet, and you can see the scrolling number and talk to our appointment team, take an appointment and meet us. Definitely we will help you. After you meet us, you will definitely be very happy with us. Thank you.
Dr. Sampath, very nice talking to
Yeah.
you, and I really wish I met you more than a year back.
Yeah.
I would not tried for my daughter.
Yes.
But anyway, that is too late for us. But
Yeah.
The point of bringing this program is that to help people, to inform people that if there is something in Hyderabad which you can try, as he says, that free of cost, and then of course definitely you talk to your oncologist and take him into confidence and try this out. And as I say, it's only a food supplement or supplement to whatever treatment you are going. So it's a win-win situation to all the people. And thank you very much for your time.
Thank you so much.